Hello, welcome to my channel. My name is Monica, and thank you for joining first video. I'm here to share with you my journey in bioidentical hormone replacement therapy, or BHRT for short. I got into the BHRT program just recently due to my perimenopausal symptoms. I am 46 years old, and so I'm a few years away from menopause. Of course, as we all know, at age 40, sometimes even earlier for other women, our hormones start to decline. And so mine pretty much started, I believe, when I turned 42. It started gradually. I did some research, of course, on the internet, and I checked out some books to read about what my symptoms were all about. And I realized it's due to declining hormones. So what I did at first was to start making better choices in what I eat. I started eating whole foods. I stayed away from junk food, stayed away from sugar. I limited my sugar intake. Stayed away from gluten, grains, anything white rice, or white bread, pasta. I stayed away from. So that has made improvement on my perimenopausal symptoms. And about 2 years later, the symptoms came back, but even more aggressive. I started to feel fatigued. I felt like because I have fibroid in my uterus and cyst on my ovary, and I felt like I have a lot of inflammation. So I started researching on the internet where to find a doctor that practices natural medicine, more like a naturopathic doctor. So I found one in our area, and I went to her, and she gave me some supplements to help with my symptoms. At that time, she let me know that my thyroid wasn't functioning, or I have low thyroid. My adrenals were out, and she was wondering, how I still have the energy to be up on my feet. I guess I was just powering through it. But my complaint when I first saw her was that my period was very, very heavy, and that I needed something to relieve me of my PMS. So she gave me supplements to support my thyroid and my adrenal. Those were the two supplements that she gave me, and then immediately I saw improvement along with the other supplements I was taking at that time. So it made a huge improvement. So I continued on with what was given to me by my naturopathic doctor. And 2 years later, my symptoms came back, and once again, even more aggressive, to where I can no longer really deal with the pain. And I was close to making a decision to get my fibroids taken out, but I didn't want to go through having a full hysterectomy. So there's this doctor in my area that I have been following. He practices, part of his program is BHRT. So recently in May, I decided to go see this doctor and see what he has to say, because after doing many research on BHRT, I felt that right decision for me to deal with my perimenopausal symptoms and prepare myself for menopause. So in May, I went to see this doctor. I got my blood work done, and we went over my results, and he let me know that I have severe anemia. And he was so surprised. Once again, he is the second doctor who was surprised that I was still able to be up on my feet. Not sure. But with anemia that I have, I was close to getting blood transfusion. Usually he said that most patients would be just be laying in bed and not be able to do anything because they won't have the energy to do anything. Once again, I was just powering through it. And he reviewed the rest of my blood results. He let me know that my thyroid is low, my progesterone is low. Thus, I'm not sure if I can't remember if I have excessive estrogen, but the estrogen and the progesterone ratio balance, it's basically it's imbalance. And then I have low testosterone, low growth hormone, what else? Low pregnenolone and DHEA. So he prescribed to me pregnenolone, progesterone, DHEA, and supplement for my thyroid, and testosterone implant. Immediately, I started with the progesterone, the pregnenolone, the DHEA, and thyroid beginning of June. And I got my testosterone implant on June 10th. 2-3 weeks later, I had my period, and I was so surprised that my bleeding wasn't heavy. Part of my symptoms was heavy menstrual period. And I went through my period like nothing. I didn't feel any pain, no cramping. I didn't have to wear overnight pads. I was able to go to work, and I didn't even have to complain about cramping or any of that stuff. I was able to eat because usually before, whenever I get my period, I'm unable to eat. I would lose up to 5 pounds in 3 days because I can't eat, I can't drink, I'm just laying in bed, nothing. And I get headaches. So a lot of symptoms were relieved. My symptoms include joint pain, dry skin. My dry skin has improved since I started eating healthier and taking natural supplements to support my to help with my skin and my thinning hair. But the joint pain has been relieved. I have insomnia. My sleep has gotten better. My energy, I'm so excited about my energy. I'm able to do things now. That's why I'm here in front of the camera today. I'm discussing this with you today because I have the energy to do things. I have my motivation is back, my drive is back. I have so many things that I wanted to do, but I don't have the motivation to do anything. I've been wanting to do this video for quite some time now. Even my husband has noticed all of the improvements. It's wonderful, and so I wanted to continue to share my experience with you. I want you, I invite you to follow me in this journey, and share with me what your experiences are, how you feel, and what you're doing to feel better and to relieve yourself of the symptoms that you're having. I know a lot of women have issues with mood swings and irritability. I don't really have that. I don't have mood swings. My personality is, I'm usually always happy. So when I feel irritable from time to time, then I can immediately acknowledge that I am irritable. I'm not in a very good mood, but it doesn't happen all the time to me. When I do get it, I can immediately notice it. My journey in BHRT is, will be part of my channel. So join me. Let me know what you wanted to see in my next video. If you like what you see here, and if you want to follow me in my journey, please hit the subscribe button and press on the notification bell. That way you will be notified whenever I upload new videos. Other videos will include cooking, organizing, cleaning, home decorating, basically, you know, lifestyle videos, anything that, you know, we women are interested in, which is usually running the household. Thank you, and I hope to see you again soon. Bye.